Hi everyone, thanks for tuning in. I know I originally said I wanted to provide a weekly update and I have been MIA for 2 weeks. I am so sorry. I've been wanting to post a video, but I've been thinking long and hard about the content of these videos. I had a good high school friend tell me or message me on Facebook telling me he was happy that I was providing much needed reliable information, but that he would regrettably not be watching my videos because of the fear and anxiety COVID-19 causes him. That prompted me to reflect on the videos that I've posted so far and to really think about what kind of message I want to put out. I initially started this vlog to record my own experiences, my feelings and thoughts regarding the changes that are rapidly occurring. I'm realizing that because this video is on a public platform, it reaches a diverse audience, people young and old, people in the healthcare field, and the general public. Since I am identifying as a registered nurse, I know the weight of my words is strong and I have a responsibility to put out accurate and timely information. With this being said, I will always cite my sources and strive to use credible websites for the information I provide to you. Additionally, I don't want to be seen as criticizing my job or the hospital or its policies. I am proud of the people I work with, the leaders within the hospital, and the hospital itself. The point of me detailing the changes in the hospital policy is to give you guys an inside look at what your local hospital is doing to prepare for the surge of patients that we're expecting over the next couple of weeks. It is in no way to criticize my employer at all. I think it serves as a good reminder that nurses, doctors, healthcare workers are all continually working to make sure we continue to prepare for the surge in hospital census, especially in this current time where politicians in Nebraska are trying to ease restrictions. I just want to show that experts in COVID-19 are still preparing for the worst. So without further ado, we can start talking about some of the hospital changes that have been happening in the past couple of weeks since we last talked. So our expected peak date in the state of Nebraska, the day that we're expecting the most deaths, the day that we're expecting the most resources to be needed is going to be on May 13th. This date is ever changing and is based on a predictive model that experts put together to measure different factors such as when social distancing was put in place, how strict measures are, etc. So you can find this predictive model at covid19.healthdata.org, and I will provide a link to this model in the description below. We were also told at a unit meeting on Wednesday, April 22nd, that my unit, which is called Progressive Care Unit, or PCU for short, has officially been designated as the COVID Overflow Unit, meaning if the currently designated units in my hospital are at capacity, we will start taking COVID patients on my floor. They showed us a map of what my unit would look like once walls were installed to separate those rooms from the rest of the rooms on my unit. Just to show how quickly things are moving here in the hospital, the very next day we had a construction crew putting up walls and closing off a part of our PCU unit. That was on Thursday, April 23rd that happened. The doors to the walled off area did remain open until just a couple days ago. So Friday, May 1st, 2 days ago, we did receive our first COVID patient on PCU. I want to just attach some pictures of when the construction crew got to PCU and they were putting up the walls. I was there and was able to take some videos and pictures. So like I said, May 1st on Friday, 2 days ago, we got our first COVID patient. This means that part of the unit will now be closed off and open only for COVID patients from now moving forward. Here are a couple pictures from Friday showing that closed area. My work mom, Carla, one of the most experienced and amazing nurses on my floor, was assigned to those patients, and she was the only nurse allowed in the room other than the charge nurse to minimize cross-contamination. So I'll show you guys here. Since we are now seeing a moderate amount of COVID patients in the hospital, they have made changes to the code policy. If you're not in the medical field and don't know what a code is, that's an emergency in the hospital. That means someone's heart stopped beating or that they are not breathing. There's usually a code button somewhere readily available in the hospital room that activates the code team, which is a designated group of doctors and nurses, respiratory therapists, phlebotomists, etc., that are always prepared to help during a code. A code blue is announced overhead, and whichever healthcare professional is closest can come help as well. So obviously with an emergency of that nature, there's usually a large response and plenty of hands on deck to help with CPR, giving meds, attaching the monitors, etc. The room becomes increasingly smaller as people pile in to help. Now, because we are seeing more COVID cases, only 5 people are allowed in the room at the time. Reason being is because we must don proper PPE as if the patient was COVID positive for all patients that are coding. So that means eye protection, face shields, N95 masks, gown, gloves, and a hairnet. Since all this personal protective equipment must be worn, this is the reasoning for only allowing 5 healthcare professionals in the room to help preserve PPE during codes. Lastly, though we are still allowing no visitors in the hospital is planning on reopening elective surgeries tomorrow, Monday, May 4th. Hospital census has been down in the last couple of weeks. Part of that reason is because there have been no elective surgeries being done. Elective meaning the surgery is not a matter of life or death. There are some requirements that the state of Nebraska has put in place before healthcare facilities can reopen elective surgeries, and they are the following. 30% of beds must be open, 30% of ICU beds must be available, 30% of ventilators must be available, and we must have 2 weeks of PPE available. Our incident command team at the hospital will be monitoring our compliance with these guidelines and ratios multiple times a day using this whiteboard. They also are monitoring how much of each personal protective supply we have. Here, this picture is from April 29th. Moving on, I want to talk a little bit about what's going on in Nebraska with coronavirus. So as of Friday, May 1st, in the state of Nebraska, there are 4,281 confirmed cases and 27,577 people tested, both positive and negative. Since I haven't uploaded a video in a couple of weeks, I just want to compare that number to the previous Friday's number. On Friday, April 24th, there were 2,124 confirmed cases in Nebraska, so we did see a doubling of numbers from 2 weeks ago to this past week. The information for the number of cases in Nebraska I am getting from a daily incident command email that I get sent from CHI Hospital. So I don't have the link of that information for you. Something else that I want to talk about regarding the cases of Nebraska is that we are seeing hotspots emerge across Nebraska in cities that have major meatpacking plants near them. To put this in perspective, Hall County in Grand Island, Nebraska, has the largest number of cases in the state per a local news reporting agency, with a total of 972 confirmed cases as of last Wednesday, April 29th. This was per KSMB Local 4 News. Let's see. They are also home to one of the largest meatpacking plants in the country. It's a JBS meatpacking plant, which is responsible for 237 out of the 972 cases in Hall County. The problem is so severe that this past week representatives from UNMC inspected the plants, the meatpacking plants, and approved new safety protocols. Despite the obvious outbreaks and now 10 deaths in JBS Grand Island meatpacking plant, Nebraska will not close. He said, "You want to talk about some protests going on now? Think about how mad people were when they couldn't get paper products. Think about if they couldn't get food. We would have civil unrest." That's what the governor of Nebraska thinks. Additionally, President Trump signed an executive order last Tuesday to force meatpacking plants to stay open as an essential business. Many advocates for workers and immigrant rights are against this, stating that workers are being sacrificed. I think that this could be a potential death sentence, is a quote that I took from an article. Even though recommendations have been made for after experts tour the meatpacking plants, these recommendations are not mandatory, and there is another barrier to their implementation. At least a fourth of plant workers are undocumented. Because of their undocumented status, many of them feel like they do not have a voice. In an article by Mother Jones, they interviewed a 23-year-old from Lincoln, Nebraska, whose father works at Tyson, one of the meatpacking plants here. The 23-year-old stated that they feel like they don't have a voice. The reluctance of workers to speak out, combined with business-friendly politicians at all levels of government, as well as overwhelmed and cash-strapped advocacy organizations and local medias with dwindling resources and few reporters who speak Spanish, has created a culture of silence. She believes that this not only permits worker mistreatment in the first place, but also allows meat packing companies to make promises to institute new safety measures without fear of follow-up from either politicians or the press. I've been reading a lot about what's going on in the meatpacking plants in Nebraska and been following the news about it just because it affects me close to home. My aunt currently works at Tyson in Council Bluffs, Iowa, which is right across, if you live in Omaha, you know that it's right across the river. And then my mom was a meatpacking plant worker for over 20 years. So it's something that I hold near and dear to my heart. Making sure that these workers have proper rights and protections. Moving on, talking about some more context, some more numbers in the United States and worldwide. Just briefly, I want to talk about how many cases there are in the U.S. There is 1,093,880 confirmed cases and more than 60,000 deaths. This is according to the WHO website. And then worldwide, we have 3.3 million confirmed cases and 238,730 confirmed deaths. That is, of course, according to the WHO website. Also worldwide, I was going to focus a little bit on Spain. Spain last time we talked was having one of the worst outbreaks during that time. Most cases and most deaths last time that I filmed the video. They have seen a steady decrease in deaths per day, and so yesterday, May 2nd, was the first day that adults were allowed outside of the house into the streets to do exercise and get some fresh air. They have been in a complete lockdown for many weeks now. Reason I know this is because my brother actually lives in Madrid with his wife. I will provide a picture of him outside for the first time. In the picture, you'll see a memorial that was made for the lives that were lost in Spain. So in conclusion, I just want to thank you for taking a listen to my video. I'm sorry for the long delay. I just really wanted to make sure to gather my thoughts and really get a good understanding of what kind of things I want to talk about in this. I think I decided I'm going to focus mainly on hospital policies and things that are going on in Nebraska, especially with the meatpacking plants right now. So yeah, I just want to thank you guys for following me. Feel free to ask me any questions, any concerns that you have, anything that you want me to talk about, or anything that you want me to talk less about. Just go ahead and let me know in a comment. And I really appreciate you guys watching. Stay safe. Continue to practice social distancing. I know local officials, the mayor, the governor of Nebraska, the president of the United States want to ease restrictions, but if you take a look at what all the healthcare experts are saying, all the scientists, all the researchers, they don't think it's a good idea to start reopening things until cases have started to go down. And that has not happened in Nebraska yet. So I just want to remind you guys to stay home, stay put, stay the course. This is only going to be prolonged if we continue to reopen early and have cases surge again. So thank you guys very much. Have a good afternoon. Bye-bye.